Hello, Gross Anatomy students. This is Dr. Cosby. Our first stop and our first online lecture in this entire lecture series is going to be on foot anatomy and function. And I always start gross anatomy with the foot. And the major reason for the starting point is to really take a macroscopic view at the entire human body. I believe that the foot is one of the most important bony anatomical structures within our entire human body. I know we have vital organs such as the heart and the brain, which are vital to our life and sustaining life. But when we think about bony structures in the body that allow us to be who we are as human beings, I can think of the thorax, which is going to protect our heart, and I can think of the foot. The foot, when we think about it from a larger perspective, when we wake up in the morning, what's the first thing to make contact with the ground? Hopefully you didn't say your head, right? It's our foot. It's the first point of contact with earth. It's our first point of contact with the ground. Now, there's an assumption inherent, right? That our feet are attached to our lower limb. We certainly have patients or clients who may not have feet attached to their body. So in that instance, something else may contact the ground first. But in a large population across the United States, the foot is the first point of contact with the ground, which tells us a lot about the importance of the foot. The foot is important for making contact with the ground, but it certainly is also important for allowing us as human beings to stand up in an upright position, right? So today, what we're going to do in this lecture is really just dive deep into the topographical anatomy and function. So what I mean by topographical, I mean diving deep into the skeletal components of the foot and truly understanding it. Now, in class or in our sync sessions, depending on which section you're in, we will dive deeper as we get hands-on experience in dissection with the cadavers, or as you watch me dissect in the lab setting, and we'll understand how the topographical anatomy ties to the cadaveric dissection, and how all of that becomes important to understanding the structure and function of specific joints that we're covering in this class. I do want to say, I recognize that some of us have never had an anatomy and physiology course. So if that is you, then I'm creating this lecture with you in mind. If you are on the opposite end of that spectrum and you have certifications and you've had a few anatomy and physiology classes, then consider this a review, right? Consider this additive knowledge to what you already have. Make sense, guys? All right. So our first stop is actually going to be in the skeletal anatomy. What we know about the foot is that the foot is comprised of 26 bones. There's no doubt about that. We can count them. What we know is that some people are born with bones that are fused in the foot, but they still have 26 bones for the most part, unless, of course, they've had bones removed, right? So they've had like some type of osteotomy or a bone has actually been removed from the foot. Very rare circumstances, but it certainly does happen. But when we look at the foot and we look at that anatomical structure, we have to think about the foot in segments, is how I like to look at it. What we know is that most posteriorly, the calcaneus and this talus up here make up the rear foot. So it's the most posterior aspect of the foot, right? So if we're looking at this foot model here, this is going to be our calcaneus. And then we can see right here on the dorsum part of the foot, this is the talus. Those two bones are in their own segment called the hind foot or the rear foot, right? Next, we have the seven tarsal bones, and those seven tarsal bones make up what is called the midfoot, right? And then last but not least is the forefoot, which is comprised of the metatarsals and the phalanges, right? So we've got the metatarsals here, metatarsals 1 through 5, and then we have the 14 phalanges. So we can see that the foot is broken down into segments. And those segments are extremely important to foot function. They operate together as a family, but in some instances, in some components of actual gait, they work independently to allow the foot to do certain things that it needs to do while we're walking. Does that make sense so far, guys? I hope so. Okay, next on the foot in terms of like topographical anatomy, we have arches, right? We have arches in the foot. I think the most common arch, the most visible arch is the medial longitudinal arch, right? And as the name implies, it's on the medial aspect of the foot. So it's this arch on the medial aspect of the foot. But we have other arches. We have our lateral longitudinal arch, which can be found on the lateral side of the foot. Again, when that foot is in complete contact with the ground, that lateral longitudinal arch, you really don't see it, right? It goes away. Most often, though, in our patients, we'll see, or in our clients, we'll see a medial longitudinal arch. Unless, of course, they have a flat foot. Then that arch drops down towards the ground, right? The last arch, which is usually not as intuitive for students, I'll give you a little perspective here, is the metatarsal arch, right? Just think these are metatarsals. We're looking at the plantar aspect of the foot. These are metatarsals. And so we have this metatarsal arch right here. And this will become important if we're talking about pathologies such as like neuromas, metatarsalgia, right? It's this arch that kind of gets lax and allows those heads of the metatarsals to drop down to the ground and cause irritation in the foot, right? So for review, we have 26 bones in the feet. We have 3 segments of the foot. We have the rear foot. We have the midfoot, which is comprised of the 7 tarsal bones. We have the forefoot, which is comprised of the 5 metatarsal bones and the 14 phalanges. We also have a foot-like structure, one that is kind of contained within an arch-like structure. And those 3 arches are going to be the medial longitudinal arch, which is going to provide massive amounts of support to the medial side of the foot. We have the lateral longitudinal arch, which is important in gait and provides lateral stability to the lateral side of the foot. And then on the plantar aspect of the foot, we have the metatarsal arch, which is going to provide support to the distal portion of the phalanges, or distal portion of the metatarsals, and the proximal portion of those phalanges. Okay, as we progress, it will become important to really look at this as I just mentioned it on the other side. We're just getting a really good view of this, right? We can see the rear foot here. So we see the rear foot with the calcaneus, right? We can see the midfoot with the tarsal bones located here. And then we have the metatarsals and phalanges. So that is going to make up the forefoot. And if I could really talk to you guys about gait, I know some of you haven't taken Dr. A's biomechanics course yet, or aren't gait experts. But when we think about those segments of the foot, we have to be thinking about, what does the foot look like in heel strike? What does it look like when the foot's flat on the ground? And then what does it look like as we get ready to toe off all over again in our gait? Each of those segments, the rear foot, the midfoot, the forefoot, they all work together. They all work sometimes asynchronously to control the motions at the foot and allow us to be a mobile foot and a mobile-like structure, okay? So in the foot, we have to think about bones, right? We have to think about segments of the foot. And then ultimately, in a gross anatomy class, this is where we dive deeper, because we want to know what is supplying our foot. What neurovascular structures are supplying the foot? So that if I take a crushing blow to the foot, right, I want to know if I'm still receiving blood to that area. Well, on this image, you can see here that we have a large artery. In particular, one of the major arteries that supplies the foot, at least the dorsum of the foot, is going to be this dorsalis pedal artery. In the clinical setting, we call that the dorsalis pedal pulse. So you can see where it lives. It lives just in between digits 1 and digits 2, right? And it's probably in its prime. We can see that it sits right here over that navicular bone in between metatarsals 1 and 2. So we want to do a pulse check there, right? Imagine this. I have an athlete or a patient. Athlete gets stepped on. Patient drops a weight on them. We need to know if they're getting blood flow to those distal extremities, right? One way to do that is with what you see on the slide, to check a dorsal pedal pulse, right? And remember I said that dorsal pedal pulse is kind of in between digits 1 and 2 and right over that navicular bone. So that's a dorsal pedal pulse check. In terms of dorsum of the foot, and we will call this superficial anatomy, we have the extensors of the toes, right? And you can see this kind of illustrated really well in this image here. We have number 3 is going to be the extensor digitorum longus. Its major role concentrically, think about that. To concentrically contract means to shorten a muscle. to eccentrically contract would be to lengthen a muscle. So if I'm flexing my elbows, right, then I'm concentrically contracting my biceps muscle. If I'm extending my elbow, I'm eccentrically contracting that muscle, lengthening it so the triceps can take over in that contraction moment, right? Here, what I'm saying to you is that number 3 is the extensor digitorum longus. Its major role concentrically is to pull the toes into toe extension, right? So we can see that here in this foot model. Here are my toes. Extensor digitorum longus is going to pull digits 2 through 5 into extension, right? Then we have number 4, which is the hallucis muscle. It's the extensor hallucis longus. Now, one thing that you probably already know is that the first ray, either the thumb or the toe, the big toe, they have their own muscle supply. Isn't that unique and distinct, right? And so digits 2 through 5 always kind of share a muscle, and then digit 1 is going to always have its own, and that muscle is usually named hallucis. And depending on which part of the foot it's on, if it's on the dorsum of the foot or the top of the foot, then that's going to be an extensor hallucis longus muscle. And then if it's on the plantar aspect of the foot, that's going to be a flexor hallucis muscle. But for now, we're looking at the dorsum of the foot. And so we can see that this is the extensor digitorum longus. Major role is to extend those digits. This is the extensor hallucis longus, so its major role is to extend digit 1, right? Digit 1. Are we tracking there? Okay, great. Now, as we progress upwardly, we have a few other components or anatomical structures that we certainly can talk about. If we're looking at number 2, remember these are the muscles of the fibulari muscle group, and this is the fibularis tertius, and we'll talk about it more when we get to the compartments, but for now, it has an attachment to the dorsum of the foot just at, believe it or not, the base of the fifth. As we progress more proximally and we look at what number 3 is, again, what we're saying is this is just the tendinous slip, one of the tendinous slips of the extensor digitorum longus, right? So here are its actual individual slips, and then here's where we see those slips coming together to make one kind of tendinous structure. And you can see it being held in place by this extensor retinaculum, right? This extensor retinaculum is going to be hugely important for holding the tendons of the extensor digitorum longus intact within the actual foot itself. Now, this big tendinous structure here is known as the tibialis anterior. Concentrically, its major role in terms of movement of the foot is in a dorsiflex position, but it is absolutely a secondary inverter of the foot as well, right? And just for perspective, we have our lateral malleolus and our medial malleolus, right? So we've just looked at the dorsum of the foot or the top of the foot, and we've looked at all of the muscles, right, that have some attachment to the dorsum of the foot or help the foot get into a dorsiflex toe extended position, okay? As we progress, let's go ahead and talk about the lateral musculature of the foot. There are many muscles on the lateral side of the foot, but the ones that are most important that we haven't talked about really are the fibulari muscle group. What we know about the fibulari muscle group is they are a group of 3 muscles. One of those muscles is right here. That's the fibularis tertius. Remember I said it attaches to the dorsum of that 5th metatarsal, so here. But then we have the other 2. The first one is the fibularis brevis muscle, which has an attachment directly to the most lateral side of the base of the 5th. So different attachment sites for the 2 muscles. And then the third muscle in the group is the fibularis or peroneus longus. Now you might see that it disappears here because, believe it or not, that longus, as its name implies, longus, dives down underneath the plantar aspect of the foot and drives all the way down to the plantar aspect of the first ray. So its name longus is intentional. It is one of the longest peroneal muscles. It is the longest peroneal muscle, right? So we have 3 peroneal muscles in the peroneal group. We have the fibularis tertius, which attaches to the most, dorsum portion of the 5th metatarsal. We have the fibularis brevis, which attaches to the most lateral side of the 5th metatarsal. We have the peroneus longus, which dives deep on the plantar surface and has an attachment to the first metatarsal itself. So those are the lateral muscles. Oops, you can kind of see them here as they come off of the malleolus. So number 4 is going to be peroneus brevis. This thinner tendon right here is going to be peroneus longus. And if we look here at number 3, we didn't see a really good image of it on the other slide, but this is the extensor digitorum brevis muscle, not longus, brevis. How many of you are soccer athletes or have worked with soccer athletes and they have that big, huge muscle belly on the lateral side of their foot? If that is you, then what you are seeing here is the extensor digitorum brevis. They use it a lot, right? To kick the ball. Number 2, you guys should know this and you should be yelling it out at me as the extensor digitorum longus muscle. Okay, on the medial aspect of the foot, we have a few major players. We call them the Tom, Dick, and Harry muscle group. So if we're looking here, we have the Tom, which is going to be tibialis posterior. We have digitorum or Dick, which is digitorum longus, the flexor digitorum longus. And then last but definitely not least, we have Harry, which is the flexor hallucis longus. So Tom, Dick, and Harry are on the medial aspect of the medial malleolus. It's those 3 muscles as a group that work together to plantar flex the foot concentrically, but then they also, like the tibialis anterior, secondarily help bring the foot into an inversion moment, right? So as we look at all of these images, it's really hard to see many of the muscles on the medial aspect of the lower limb, right? The one that we can see if we really invert the patient's foot is the tibialis posterior. And then obviously just for resource, this is the Achilles tendon, right? We would know that as the Achilles tendon. And then letter number 1 is the great saphenous vein, which I'll show you in dissection. It's an extremely important vascular structure, which is used a lot in heart transplants. We'll sometimes replace the vascular structures in the heart with this particular vein. So it becomes an important anatomical structure to recognize as you are dissecting. And then we have the sole of the foot, which is where we're going this week in our class. The sole of the foot is a very thick and tough structure. As I alluded to early on, it has to be because it's making the most contact with the ground. So why our skin is so hard, most of us, right? On the plantar aspect of our foot, it's actually a protective mechanism so that the deeper layers of the foot do not get injured. But if we were to dissect away all of this skin, right, then the layer that we would see next would be the plantar aponeurosis, or as you might know it, the plantar fascia. The plantar fascia is extremely thick. Like when we dissect this, it'll take 3 or 4 scalpels to get through the skin of the foot to actually the plantar fascia. But this is the plantar fascia, and as you guys can see, it has an attachment to the calcaneus, but then it also travels up to those phalanges and has an attachment to each of the phalanges, right? Making this an important anatomical structure for foot stability. The plantar fascia, as you can tell, reinforces the medial longitudinal arch, reinforces the lateral longitudinal arch, and certainly provides reinforcement for the medial longitudinal arch. So injury to the plantar fascia has implications for foot function and structure, most certainly, right, you guys? Okay, so we have layers of the foot, and I do a full-on lecture on the layers of the foot, but I want to lay these here for you by saying all of the layers that we share in this class all have unique and distinct functions. But the major role of the intrinsics of the foot are to provide foot stability and to allow the foot to become mobile when we need it to become mobile, right? They are, to me, the key to the foot. They provide the stability to those 26 bones that we have in the foot, right? And if they get injured, then we have a foot that becomes extremely mobile, right? Hypermobile, which isn't always a good thing. So in the first layer of the foot, you'll see it on this table here. We have the adductor hallucis muscle. We have the flexor digitorum brevis, and we have the abductor digiti minimi. And you can kind of see these here, but you're not going to see them until you really see them in a cadaveric a specimen. So we'll do that in our sync session or in class so that you guys can actually see what they actually look like. But ultimately, you can see that the role of the first layer of the foot is to allow that foot to kind of abduct, right? And to flex. So in some instances, we could say, okay, we've got toe abduction and we've got flexion of the digit. So stability, foot stability, right? Foot stability, massive foot stability. The second layer of the foot is composed of two muscles. The first is the quadratus plantae, which you can see here. It has a direct attachment site to the flexor digitorum longus. So a lot of times this muscle goes unnoticed because you assume that it is a part of the flexor digitorum longus. So I'm going to show you that in lab or in sync session so that we can make sure we can differentiate between the quadratus plantae and the flexor digitorum longus. Okay, so then next we have the lumbricals, and I'm going to point to them. Lumbrical 1, lumbrical 2, lumbrical 3, lumbrical 4. We can see that those lumbricals are connected to which muscle? Right, they're connected to the flexor digitorum longus. So again, they get mistaken as the flexor digitorum longus, but here it is. These are the flexor digitorum longus tendons, and in between there, we have the different lumbricals. Major role of I would say, of this particular layer is the same, to provide foot stability, to make sure the foot is an extremely stable structure. The third layer of the foot consists of the flexor hallucis brevis, the adductor hallucis, and the flexor digiti minimi. So again, if we're looking at all of this and we're saying, what is the role? All of this is lots of flexion, so lots of foot stability. Intrinsics of the feet are major players, are you tracking, in providing foot stability. So injury to them, and now we have a completely unstable foot, a bag of bones, essentially, right? Now, the adductor hallucis should warrant a little bit of discussion because it is a muscle that is bifurcated. And so if we look at the adductor hallucis here, I think of it as a number 7. We have what we call is the oblique head and the transverse head. So we have the adductor hallucis transverse head, and then you have the oblique head. So we'll identify those in dissection as well. The fourth layer of the foot is probably the hardest layer to view, at least from a gross anatomy dissection perspective. Most often it's hard because those muscles are just extremely small. But essentially what we have in here are the interossi, the plantar and the dorsal interossi, and you can see them here. They're just very hard to distinguish, but their major role is to, at least plantar interossi, are to adduct, to bring our digits together. And then the dorsal interossi, their major role is to abduct, so to allow the foot to widen or the toes to widen. Overall, you guys, I think this is the end of the PowerPoint, but what I want to say to you guys overall is we need to understand the anatomical makeup of the foot. We have to understand the role of the intrinsics of the feet, which is really to provide structure and integrity to already bone-like structure. We can see here there aren't tons of tendons or ligaments, so most of the stability to the foot is going to be given through its intrinsics of the feet. So I hope this was helpful. I'm looking forward to seeing you either in class or in sync session. Have a wonderful day.